This is the first question I know any partner in practice will ask. And that's why I think Sam has come up with this amazing model because they work with insurance and payers. So if you have a certain commercial insurance, your insurance pays for the plan. So you get this trained GINP, GI supervision, and this wholesome care with the dietary and behavioral health provider included with your plan. And cost, we know, is a big barrier to these patients. That's also one of the reasons as a GI, we don't refer these people to subspecialist care because there's poor coverage. So that piece of the puzzle has been answered really well. It's part of your plan. You get this ancillary service, it's part of your insurance plan.
Yeah, I mean, and that's a big part of our mission. If you really sort of go back to why are we building Oshi the way we are, we're really trying to fill in this missing piece to be able to help local practices support that patient in that moment, which actually strengthens the relationship long term with that local GI provider. So that when that person eventually does need screening colonoscopy or has an escalation in their symptoms and needs to be seen in person, the patient is now retained by that practice, and Oshi can help with that. And so back to coverage, a big part was to scale access to these services. The second piece was to make sure they're covered as part of the benefits for an insurance plan. And this has taken time. The clinical trial results, especially showing that we saved over $10,000 of cost in 6 months in that clinical trial, that has really helped us start to get payers and employers to cover this for their people. And so we are seeing, like, every week, more and more employers coming to us saying, we're really interested in this. We've seen the data. We see how this impacts. We've seen your pilots. We've seen your clinical trial. Like, we want to bring this to our population. And that's a big part of why we've now committed to scaling to all 50 states. It took a little longer, Praveen, than when we had that original conversation, because we wanted to do it carefully and thoughtfully and make sure that we could scale and deliver the same quality, the same experience for the patient, and the same value for the purchaser. And so we're doing it now. We've got national scale employers, with people in every state, some of them with people in every zip code. And so we need to be able to provide this care everywhere to serve them.